I'm just making it Facebook Live, so it's just getting prepared, and once it's ready, we'll do it. All right, good evening, everyone. I hope I'm audible and loud and clear. Uh, at the outset, let me thank everyone for joining in and tuning into this session of Via Delhi on A to Z on the impact of COVID on kids. At the outset, let me thank Dr. Anupam Sibal to have taken time out from his pressing schedule right now in these times that we are facing for coming forward and sharing his thoughts and suggestions and helping us to tide over these issues. I know there are a lot of people who are not part of YI, so I will just give a brief about what YI is, what are the initiatives that we do, and then I will pass on to Anchal to go ahead with the proceedings. So YI is the youth forum of CII. It's called Young Indians. We have a 20-year-old organization. We have got about 4,000 odd members across 55 odd chapters across the country. We work in three major initiatives: nation building, thought leadership, and youth leadership. There are about 15 to 16 verticals that we function in. We look at areas which is having significant, opportunity for people like us, influential and privileged people like us, to contribute back to the society and help in nation building initiatives. These includes engaging with the youth through leadership programs. These include educating people about child sexual abuse and creating awareness. This includes educating people about road safety and multiple other activities. As recent as part of COVID, because of the importance that it matters, we have launched a new initiative trying to help and give support to the parents of children. So the parents who have lost their job or who have had deep salary cuts or have had significant business loss. So for them, if we can provide some amount of education, subsidize a part of their education, it'll be a huge sigh of relief for them. So we have created an initiative and tried to create a fund wherein we can contribute a portion of the tuition fee or the education cost that they are incurring. So that's the most recent initiative that we have done. We're trying to scale it up. We've just launched it, and by the end of the seminar, we will be sharing the details of the same. So please do log in and see how you can contribute. Otherwise, I hope all of you have a great session. Over to you, Anchal. Thank you once again, Anupam.
Thank you, Srivat. A very good evening to everyone. My name is Anchal Bansal. Before we proceed, I hope I'm audible to everyone.
Sure.
Yeah. Before we proceed further, I would like to share a few housekeeping tips with everyone. Kindly do not unmute for us to have a seamless session. And if you have any, we will do Dr. Sibal will do a 15 minutes presentation with us. So meanwhile, if you have any queries, please leave them in the chat box or press raise your hand icon, and we will get back to your queries while we have a Q&A session. Now, allow me to introduce Professor Anupam Sibal. He is the Group Medical Director, Apollo Hospitals Group, and he's authored the book, Is Your Child Ready to Face the World? A very good evening, sir. It's a pleasure to have you here and share the screen with you. Thank you so much for taking out time out of your busy schedule at such a short notice for us, and for us like panic-stricken parents who every now and then just think about COVID. It's all over, it's all around us. Sir, I would request you to share your views and enlighten us about this second wave, what is going on, and what precautions we as parents should take and prepare ourselves and our kids for the third wave.
Sure, thank you. Good evening, Srivats, Varun, Anchal, distinguished membership of YI, and of course guests like me who are not part of YI. I'm too old to be part of YI now. It's indeed a pleasure to be able to interact with you. And when Anshul said, we as parents are really stressed, I couldn't say no, because as a pediatrician, I interact with moms and dads every day, and I know that the last few weeks have been really very stressful. Ever since this whole thing started, the third wave and kids and MISC and what have you, many parents have had sleepless nights, and never did I think that it would be a possibility. But I think a couple of weeks ago, I actually did 24 virtual consults for children with COVID on one single day. So, clearly the stress levels have been high. And I think in the second wave, a lot of families have had everyone in the family, including little babies, toddlers and older children get infected as well. But it's been pretty good because none of these, in fact, I wouldn't say none, but a good 99% of them have done really well. So that's the positive news. So what I'm going to do is I'm going to do a brief presentation and show you some images, and then we shall get into a Q&A. So tell me if you can see my slides.
Yes, we can.
Great. Who would have thought 500 days later we'll be discussing COVID? It's day 513 of the pandemic. And if you look at the data, 16.8 crore cases, sadly 34.9 lakh deaths, India 2.72 crores with 3.11 lakh deaths. So we have the pandemic that we have to deal with on a daily basis as doctors. And then we also have the infodemic. So what do I mean by the infodemic? And I'm just going to share some data with you. So go on to Google and type diabetes. You're going to get 474 million results. You type COVID-19, you get 6 billion results. And if you type COVID-19 in children, you get 270 million results. When did we learn about diabetes? 1552 BC, and COVID 513 days. So just look at the amount of information that is available out there. Way more than something that we've known for 3,500 years. And that's why dealing with the infodemic in itself is a huge challenge. And many families are grappling with how to get the right information and what to make of that information. For us as doctors, we have to keep ourselves abreast of what's going on. So we look at PubMed. That's where all the peer-reviewed publications come in. I'm not talking about news reports. I'm not talking about papers that haven't been reviewed and published. So on COVID-19, there are 155,000 papers. So that's 302 papers a day. So by the time we finish this session, Anshul, there will be something like 11 papers I'll need to catch up on. If you look at COVID-19 in children, they're close to 40,000 papers. If you look at COVID and vaccination, there's 16,000. And if you look at vaccination in children, there are 6,600 papers. So that is the kind of information that we have. Well, what about kids and COVID? So this is NCDC data, and this is till yesterday. So if we look at all the number of individuals with COVID, and we look at children less than 10, that's 3.9%, and 11 to 20 is 7.99%. So roughly 12% of all those who've been infected with COVID-19 have been less than 20. So it's not that children and young adults haven't been getting COVID. And this is cumulative data till yesterday, the first wave and the second wave. So what happens when a child gets infected? The vast majority do not have any symptoms. Some of them will have low-grade fatigue, fever, a cough. This phase, we are seeing some GI manifestations, which we didn't see the first time around, which means that they get diarrhea, vomiting, tummy ache. Sometimes they complain of a muscle ache or a headache. And sometimes you see behavioral changes like, not want to do anything, become really cranky, become sleepy. And that largely is seen in younger children who can't really express how they're feeling. Then we have this MISC. So multi-inflammatory syndrome in children typically is seen 3 to 4 weeks after COVID. So it's not something that you see in the first week or the second week. This is after you've kind of recovered. We make the diagnosis if there's fever for more than 3 days. The fever is usually 103, 104. So it's not like a 99, 100. Sometimes it can have serious manifestations and the blood pressure starts to fall, and one can actually see a child who's become very sick. Sometimes we see manifestations involving the heart, and you would have all read about Kawasaki disease. This is a disease that we are very familiar with. It's a rare condition first described in Japan, but some children with MISC have a Kawasaki disease-like presentation. So, their eyes tend to get red, their tongue becomes very red. Sometimes they get swelling of the neck because of the lymph nodes. And Kawasaki disease-like presentation has now been well described. Sometimes kids can get bleeding manifestations, they can get manifestations, the skin, neurological manifestations. But it's very important to realize that less than 1% of kids who have an RT-PCR confirmed COVID will get MISC. So it's very rare. And that is something that we need to appreciate. I think way too much media space has been given to MISC, and I think every mom knows what MISC is. How do we go about making a diagnosis? We need a proper test, which is the RT-PCR. Now, if you do a rapid antigen and the rapid antigen is positive, yes, you can make a diagnosis. With the rapid antigen being negative and the child has manifestations of COVID or there's family history of COVID, then one needs to repeat with an RT-PCR or gene expert. What's the difference? The technology is different. RT-PCR takes a bit of time. It takes a few hours. Gene expert, you can get the report in about 2 hours. The kit is expensive with gene expert, so it's way more expensive than RT-PCR. Blood tests have no role in confirming the diagnosis of COVID. We don't routinely do a chest X-ray in every child. We only do a chest X-ray if the child is coughing and we suspect that we'll find something in the chest. We don't go around doing HRCTs. We do not want to expose children to radiation. We think many times before ordering anything, any investigation that involves radiation exposure. So unlike adults, we don't go around rushing and getting HRCTs done. When do we hospitalize? We hospitalize if the child is unable to maintain oxygen levels above 94 at home, or if the child's very sick, is vomiting a lot, is getting dehydrated, has a lot of diarrhea, very high fever. We also will admit a child if a child presents with MISC, but like I said, it's several weeks after COVID. And of course, mucor, because everyone's talking about mucor and black fungus. It's very, very rare in children. So I don't think we should think too much about it or worry or give any attention really to mucor. Just one bit of info about mucor. Mucor doesn't happen in everyone who's got COVID or has recovered from COVID. It happens when there is an environment which is ripe for mucor to thrive, which means diabetics with uncontrolled sugars, not diabetics with controlled sugars, because then what they have is they have acidosis. So this acidic environment in the body encourages mucor. If the sugars are very high, mucor likes that. COVID itself increases ferritin, and that iron is something that COVID likes. And if you've got your immune system suppressed, and the commonest cause for that would be in an individual with COVID, if very high amounts of steroids have been used and used inappropriately. So when you have that environment, that's when you get mucor. Very, very few children, if any at all, are going to get mucor. Now, I'm just going to spend a minute on the structure of the virus, because when we talk about vaccines, it's very important that you understand what we're talking about. So we are interested in the spike glycoprotein, right? The spikes that you can see. Just to give you a sense, there are several thousand mutations that have already been reported just in the spike protein. And most of our immunization strategy has been around the spike protein, developing a vaccine that will attack the spike protein. Now, what happens when you vaccinate? You get humoral immunity, which means that the B cells in the body start to create antibodies. So when you measure antibodies in response to vaccination, you're measuring the humoral immunity, which is the response of the B cells. But there is also one very important bit of immunity, which is the cell-mediated immunity, which we cannot measure routinely in the lab. And what the cell-mediated immunity, or CMI, does is it basically enlist the support of T cells, which create a variety of, what should I say, they produce a response which helps fight an infection. So you have humoral immunity, you have cell-mediated immunity. We can measure humoral immunity, we can't measure cell-mediated immunity. And once you've been exposed to the virus or the vaccine, the memory cells, the B cells and the T memory cells will mount an immune response should you get exposed to the virus again. So it's like meeting someone, you know, and then you don't meet that person for 15 years and you meet that person again and your memory will, okay, we met here and there. And this is what we did. So similarly, the immune system, the memory B cells and T cells will remember that there was exposure, whether it was through a vaccine or through an infection, and will mount an immune response. So this is something very, very important to remember. Now, what about the number of vaccines? So number of vaccines in clinical development, 101. Preclinical development, 183. What about vaccines where there is an emergency use license application or evaluation going on? 19 vaccines. So come a few months, there's just going to be a huge number of vaccines available. Now, variants of interest. Now, everybody is like, okay, mutation, what does this mean? So if you change the amino acid, even one amino acid in the structure of the genome of the SARS-CoV-2 virus, you get a mutation. So if there are multiple mutations and the virus starts to look different, it's called a variant. Now, if you're interested in that variant, you call it a variant of interest. But not every variant of interest is a variant of concern, because what we are really interested in is a variant of concern, which means either it's more infectious, or it produces severe manifestations, or it has a higher death rate, or it's super smart and evades the vaccine or treatment. Now, this treatment becomes very relevant because today, you know, at Apollo, we've launched the so-called Trump cocktail, or the monoclonal antibody cocktail, which actually prevents the binding of the SARS-CoV-2 virus to the cells. So you actually give antibodies that don't allow the virus to bind. So there were concerns about effectiveness of, say, the antibodies in some variants of concern. So that's why the WHO decides based on these criteria, do we have a variant of concern or not? Every mutation, every variant of interest is not important. So you have the B1.17 variant, you have the 1.351 variant, you have the 1.1248 variant, and then you have the 1.617 variant, which has been described in different parts of the country. It was called a double mutant because there are two mutations in the spike protein, but there are multiple other mutations. So what do we know about 617? Well, what we know is that based on the data from GISAID, which looks at the genome of the virus, you know, mutants that are floating around in the world, that this one is 2.6 times more transmissible. Now, vaccines and trials, and you know, this is something again that has come up repeatedly. Haven't we rushed into vaccine approval? So if we look at Pfizer, 43,000 was the sample size for the trial. Moderna was 30,000. Astra was about 20,000. Johnson & Johnson, 43,000. Novavax, 20,000. Covaxin, 25,000. Sputnik, 20,000. So these vaccines have been studied a fair bit. Now, let's look at some historical, figures when it comes to vaccines that have been used for a prolonged period of time. If we look at measles, developed in 54, then came a second version 9 years later. In 1968, we got a version that has been used extensively. MMR, which is mumps, measles, rubella, came in 71. Now, what was the size of the MMR trial? 5,000. What is the trial of the chickenpox vaccine? 5,000. And I've just shown to you that for SARS-CoV-2, the sample size for the trial was upwards of 20,000. So I think each of these vaccines has been studied adequately, and we should put our mind to rest in terms of the trials. Vaccination for kids, Pfizer-BioNTech approved for use in children older than 12. Canada and Algeria were the first two countries. Then came the US, UAE, and Singapore. Trials in younger children, Pfizer, there are trials going on from 6 months to 11 years, Moderna 6 months to 11, Oxford 6 to 17 years, Covaxin 2 to 18, J&J 12 to 17, Novavax 12 to 17. So, you know, as parents, you'd be very interested in when your kids can get vaccinated, and I think we expect the trial data to be with us in 3 months. So unless if we are importing Pfizer, which is really the only licensed vaccine for children, I guess our kids will have to wait for a few months. Vaccination, lot of buzz about vaccination. So how have we done? United States, 28.8 crores doses. India is 20 crores. Do remember that 18% of humanity lives in India, so vaccinating everyone in India is a challenge, and I don't think any country has any solutions, ready-made solutions that can be transferred for vaccinating such a large population. So we vaccinated 3 times, or we've administered 3 times more doses than they have in the UK, just to give you an example. US, the highest number in one day has been 4.63 million. India has been 4.27. We believe that India should be vaccinating at 5 million a day, and hopefully that will start happening in a few weeks. And we consistently do that and can go up to 10 million a day, which is possible. We will get a handle on vaccinating the vast majority of the adult population and then start looking at kids. We did this with polio when most people believed we couldn't, and we eradicated polio, and we will do the same with COVID. I think we just need to have faith and a bit of patience, because the size and scale is just huge. What is the supply line looking like? This came out in the media. We're looking at 130 million doses per month by end of July. We're looking at, based on all these vaccines, including some newer vaccines like the Zydus vaccine, we are looking at 2 billion doses by the end of the year. So I think we're going to see a lot of vaccination happen in the coming few weeks to months, and some positive news. I don't know if you read the papers today, but we conducted a study at Apollo Delhi. We looked at 3,300 doctors, nurses, healthcare workers who we vaccinated with Covishield. We followed them up for 100 days, and we found that 2.6% of them had got infected. That is 85. But only 2 of them got admitted. So admission rate was 0.06%. And because of this concern about the variants of concern, we looked at samples, 69 of them, of these healthcare professionals, and we looked at the whole genome. We did that with NCDC, and we found that 48% of them had 617. But despite having a variant of concern, they did not fall seriously ill. No one went to an ICU. Only 2 got admitted, and there was 0 mortality. So clearly, even against the variant of concern, this vaccine works. And of course, we'd be looking at a larger population. 7 tips before we end this. Firstly, do not panic. Do not panic if your child turns out to be positive. Please isolate, and this will depend on what's happening in the rest of the family. Please talk to a pediatrician, and there are many of us available. Follow advice that the pediatrician gives. Do not self-medicate. Do not extrapolate an adult prescription because a child is not a miniature adult. So you can't say, oh, my child's 5 years old, so I'm going to divide the prescription by 1/4 and give it. That is totally inappropriate. And please follow the quarantine protocol. It's not that kids, because they don't have any symptoms, will not spread it. And do not send them to their grandparents, because why expose the grandparents? I just want to end by saying we can, we must, and we will overcome and win this war against the SARS-CoV-2 virus-driven pandemic. We have it in ourselves as a nation to be able to do that, and we will. Thank you so much. And I'm now happy to take in questions.
Thank you so much, Doctor. It was really informative. I'm sure everyone here present here, all the parents present here would agree with me. I have a few set of questions which are asked most commonly amongst the parents. So I would like to address those, and then we will take certain questions from the chat box as well. So my first question is, how do we distinguish the symptoms of COVID vis-a-vis a normal flu, as in a normal cough, cold, or a heat fever or diarrhea? As parents, whenever our child gets infected with stomach these days, all we have to do is just to relate our mind with COVID. So how do we distinguish that?
So it's clinically quite difficult to do that. because the features of fever, cough are common. And how do kids get the flu or common cold? Is when they go to school, they go to a park, they interact with kids. Now that's not happening. So actually, these days when you have someone with what looks like flu, you have to think of COVID. And so a clinical diagnosis is hard, and you would want to test. Similarly with diarrhea, if you got diarrhea with fever, that's what one has to think of. Of course, it could be an infection, but then these kids are not really going out. Food poisoning, you don't normally have fever. So in the vast majority, making a clinical confirmatory diagnosis of COVID is hard.
Okay. And how high is the risk of the children contracting COVID with the adults? Like in adults, we know that, the ones who are diabetic or have high blood pressure are the ones who are likely to get affected, or in case they get infected, they should be taken care of more in other than the ones who are healthier. So even in the kids, is there something related to it, some specific set of kids who are to be taken care of?
Okay, so firstly, let me clear this myth. With the second wave, it doesn't kind of spare anyone in terms of getting the infection. It's more infectious. In the first wave, we got like out of a couple, one spouse would get it and the other wouldn't, and they would have spent, a fair amount of time in the same room. That is not happening now. If someone gets it in the family, you can be pretty sure that the vast majority of the family is going to turn positive in a week. So that applies to kids as well. So, it's not that because kids don't have diabetes and high blood pressure and all, they're protected from infection. They're not. In terms of hospitalization, yes, they're protected. We've clearly seen that hospitalization is more in those individuals who are older than 50, increases after the age of 60 if they have diabetes, high blood pressure, heart disease, kidney disease, liver disease, what have you. The risk of dying is much higher in the elderly with 1 or 2 or 3 comorbidities, and we've had individuals who've got like 4 comorbidities. Every child who turns out to be positive needs a certain basic monitoring and needs to consult a doctor who's going to advise on what tests need to be done, if any at all, and what monitoring needs to be done and what medication, if any at all. So I think, basically you need to do this in close coordination with a pediatrician, because you don't want to miss something, and at the same time, you don't want your child to get extra medication. So it's best done as a partnership with your pediatrician.
Absolutely. We have a question that at times it happens that the RT-PCR of the kid is negative, and the kid as such has no symptoms, because the parents, they are infected. So we have these different scenarios, I would say permutation and combination going on in every house now.
Yeah.
So how do, and there are certain kids below like 6 years whom we cannot isolate. So how do we deal with that situation? What kind of immunity boosters do the kids need to have during those times when they have to live with the COVID positive parents when they are negative?
So remember, if you test with RT-PCRs very early, it's going to be negative. If you test very late, it's going to be negative. So, you have to pick it right. Then you have to pick the right lab. The sample has to be collected properly. You can make anyone negative if you just very superficially take the swab. And ideally, it should be an oral and a nasal swab. Needs to be taken correctly, needs to be transported correctly, needs to be processed correctly, needs to be analyzed correctly. So there could be individuals who actually are negative but are not negative. Now, it's very hard to keep little ones, under a mask and to protect them. So, there is a likelihood that they'll get it. With little kids, if say the younger sibling has it, then the older one will get it. If the kid has it, and the likelihood of the parent getting it is pretty high, but of course the parents can be masked up, but there's still a likelihood of getting it. So, in terms of quarantine, in terms of how to isolate, it's really sometimes very difficult with little kids. So parents can mask, kids won't mask. So if one kid gets it, the other's likely to get it. But all one can do is take precautions and hope that they don't get it. But if they get it, like I said, nothing really to worry too much about.
There is one more question which is very commonly asked these days, everyone is advised to be on vitamin C. So how long do we need to keep our kids? Is it like an ongoing process, like just like a newborn is advised Vitanova D3, vitamin D, the kids are usually deficient in. So is vitamin C a long go we have to go, and or is it like we have to wait and give it for a stipulated time period and then again wait, watch out for child having any symptoms?
So the thing about vitamin C is we know that it helps in common cold and cough, and historically everybody has it in the winter. Now, if you ask me, there is no study that has looked at vitamin C in children to see actually does it make a difference? Does it decrease the chances of them going into hospital? Does it hasten recovery? Does it prevent serious complications? And the answer to that is no. And the same applies to zinc. So the question is, does vitamin C do any harm? The answer is no. You can give it for a few weeks, but of course you have to check the dose. Similarly, zinc we use for a variety of conditions. You use it in skin conditions, we use it in diarrhea. And so, yes, can it do any harm? The answer to that is no. But is it going to definitely make a difference? The answer again is we don't know.
Okay. And are the asthmatic children more vulnerable considering this second wave and the way the children are getting infected? And how do we combat with this kind of situation? Like in adults, we know that it's the sixth day, as they usually say, what we have heard in news and everywhere. The experts, they say that sixth day, it starts affecting your lungs. How does it go in the kids, and especially the parents, the children who already have the wheezing issue? How do we deal with that?
So if it's well-controlled asthma, I don't think you should worry. It doesn't really put your child at any increased risk. In terms of cytokine storm, which everybody is familiar with, which happens in the second week, well, children don't really usually have that kind of a presentation. For them, it's very mild. So unlike adults where you do a lot of tests at baseline and then repeat tests around the 7th day and then again a few days later, we don't tend to do that in adults. Children, sorry. So by and large, kids do really well. So that's as far as manifestation and testing goes. Another question that keeps coming up, and Geetika's asked this about vitamin C and zinc. How long can you give it? You can give it for a few weeks as far as vitamin C goes. Zinc, a couple of weeks is fine.
And we had one more question. Like in adults, when you're infected with COVID, it's the general practice that after 5th day, you need to repeat your CRP D-dimer. That is where we check all the infections and the blood clotting happening in the body. Is it something like this for kids? Do we require these blood tests? And if yes, then what?
We seldom do tests in children. I'm not saying that no child will have any tests, but some kids will have tests, but very few. So leave it to the judgment of the pediatrician to decide. We don't go around doing IL-6 and D-dimers and ferritin and CRP and what have you for everyone. Yes, we choose in certain individuals.
And if a kid is COVID positive, what is the frequency that we should check the saturation of the oxygen? Like in adults, we know our body tells us, but a kid cannot tell us.
Yeah, 3 times a day is good. 3 times a day. Yeah, and you want it more than 94.
Okay. And there is a term which is very readily used these days, long COVID. Like certain kids, they have experienced symptoms like sore throat, or as you rightly said, fever after 3 to 4 weeks, or we have come across cases where kids are facing muscle pain, headaches. Like elder children, they can tell, that they are feeling that, younger ones cannot. So what is it exactly? And if we feel that our child is going through that, then how do we take it ahead?
So one of the things which is very typical about, which is seen only in children, not adults, is MISC. So the multi-inflammatory syndrome in children. Kawasaki disease-like presentation is seen only in children. But in individuals, whether it's children or adults who've recovered from COVID, you can get a variety of symptoms for an extended period of time. And they can be very vague, from some acidity to tummy ache, to feeling bloated, to having muscle pains, to having headache, to just being very tired. So, you get a variety of manifestations, and, even 500 days later, we're learning newer and newer things about what might happen.
Okay. We have a question. Whether COVID can cause infection and pain in ear as well among all age groups with no other symptoms.
It can cause pain anywhere, but if it is a ear infection, then that's which might or might not be related to COVID, which is responsible for the pain and maybe the fever. So one would really need to check.
Okay. You talked about vaccination, which is like the current topic which is going on, and we as adults, we were also apprehensive about getting vaccinated till the time the second wave came in. And same as for the kids, and the trials are going on, as you said, and the vaccination might be out in few months. So as parents, we have this apprehension that tomorrow, even if our child is vaccinated and he starts going to school, how likely is it for him or her to carry an infection from the school? Because usually also the reason for cold and cough, flu is, when they get exposed to many children, because their immunity is really low, especially for the pre-primary kids. What is your view on this?
So, if there is infection floating around in the school, the kids are going to bring it back home. There is no such thing as avoidance behavior that a 4-year-old or a 5-year-old is going to follow. I mean, they're going to sit next to each other. You can't really keep them masked, and they're not going to wash their hands as much as we would like them to. So if there's infection floating around in school, and that's why there've been breakouts in schools, in nurseries, and so on and so forth. And that is why kids will need to be vaccinated. And that is why we need to have a program, although it's a lower priority than adults, but at some point in time, we're going to have to do that. How long does the immunity last after a natural infection is a very, very important question, because we just talked about B cells and T cells and helper cells and so on and so forth. We don't know precisely. There are certain infections where you get lifelong immunity, like if you had chickenpox, you're not going to get chickenpox again. But with other conditions, you get it again, like typhoid, you can get it again. So one thing is very clear, it does not provide very long-term immunity because people have got it again. We don't know precisely how long this immunity lasts. And one thing is for certain, that if you get it again, it's milder because your immune system kicks in. And I think for the first few months of life, after you have recovered, you're unlikely to get it again. So when that is the case with the natural infection, it stands to logic that the same will also apply to the vaccine, in that the vaccine is not going to provide protection for an extended period of time. So I think we will end up requiring a third dose or a booster at some point in time. And I don't know how often we're going to require boosters. As far as safety of the vaccines are concerned, we will they will only be licensed when we have data. And given the fact that, the knowledge and information about vaccinology has advanced so much, it will be a few months only and not longer when we will have access to a vaccine that we can use in kids.
Very well said. There is one more question, which is generally asked, that as adults, we have antibodies, and we know that for 100 days, we have those neutralizing bodies in our body. Does that work the same way for the kids?
Well, there's no guarantee that everyone who's kind of recovered has antibodies for 100 days or so. But one good thing is that even if they don't have antibodies, the cell-mediated immunity will recognize the virus and prevent a repeat attack. And if there is a repeat attack, it'll be pretty mild. In children, we don't routinely measure antibodies, so we can't really say how long these antibodies will last after an infection. But like I said, it's unlikely that they will get reinfected soon.
Any particular diet, like so when an adult is infected, people say have more of protein, it helps you. So is there any particular diet? All the parents, they are very eager to ask, is there any particular diet to be given to the kids during that phase?
So what we always want, and every parent wants that, every mom, every dad, and it's not very easy. We want the child to have a balanced diet, a mix of carbohydrate, fat, protein, make sure we have enough vitamins and minerals on board, they have vegetables, and that they have fruit. It doesn't really happen, but that's really what we want. We want a balanced diet. There's nothing specific that you can give which is going to enhance immunity, as such. And neither do we have any supplements which can enhance immunity per se. So it's a question of having a balanced diet. It's important to have the vitamins. It's important to have the minerals.
And can COVID positive mothers breastfeed their babies? This is also an apprehension amongst the mothers.
So they should wear a mask, and they can breastfeed, no problem.
And when it comes to the annual flu shots which the kids take, do they help in combating COVID anywhere amongst the kids?
I don't think they help as far as COVID goes, but where they help is that if you get a cold and you haven't been vaccinated with the flu, so it could be the flu, it could be COVID. So if you've been vaccinated, it's unlikely to be the flu. That's the advantage. But it definitely does not prevent against COVID.
We have a question from Nikhil. My 10-month daughter was positive a month ago. Symptoms were mild. She had fever for 2 days only. Yesterday, she developed some skin peeling and roughness in her back. Also, today, her left palm is swollen since morning. Don't know if something bit her or is it COVID related. Please advise.
Well, I mean, it could be an insect bite, but then she did have fever 2 days ago and she developed some skin peeling, which cannot be explained by a bite. So,
She was
maybe,
positive a month ago.
yeah, so maybe she needs a test, a blood test.
She needs a test. Could it be a symptom of MISC? Like the parent is very eager to ask.
Well, I think one would need to do an assessment and decide on tests, and then, one would entertain the possibility of MISC, if at all.
And so this is a very common question among parents and everyone. I think in the chat box so far I can read, what are the immunity boosters our kids need to have? Because especially the children who are below 2 or 3 years of age, it is very difficult for us parents to make them wear the mask. And hand wash, yes, we can make them do forcefully, but wearing the mask is still an issue. So are there some immunity boosters which we should be giving, some supplements, so that, I'm sure it cannot prevent, but it might help?
So, I mean, the best immunity booster is a balanced diet with minerals and vitamins. Like I said, giving some vitamin C, can do no harm. But other than that, we don't really have anything that's really going to boost the immune system and prevent, the virus, viral infection. But like I said, the kids' immune system reacts very differently to adults. And the vast majority of kids don't have any serious manifestations. So please don't worry if the child turns out to be positive in your home. And as far as masks are concerned, like I'm sure all the ladies in this group have very fancy masks. If you get fancy masks for kids with cartoon characters, they're more likely to accept them. So that works better with kids rather than the plain boring white ones.
We have a question from Nirmala. How can we protect children from the current COVID situation and third COVID wave, which might impact children more?
So firstly, we don't know if there will be a third wave or not. And if a third wave does come, it is going to infect, we don't know which portion of the population or which subsection of the population is going to have a greater impact. But definitely, it's not that kids haven't been impacted in the first and the second. And if the kids are vulnerable in that they have not been vaccinated and adults have, then they're more likely to remain vulnerable. And that's why we are talking about vaccinating kids as well. What can we do to prevent? Well, you take the vaccine and you follow COVID avoidance behavior and make sure that the kids see you and understand what, depending on their age, what is COVID avoidance behavior. And you please walk the talk. Don't talk about doing things if you're not going to do them. Children will follow what they see, not what you say.
Very well said. There is one more query. How early the vaccination for children is ready and they can get vaccinated, considering the situation still more than 80% of India population is not yet vaccinated?
Yes, the vast majority of the country is not populated. It hasn't been vaccinated yet. But we have to go with the trial data. So like I said, there's only one vaccine license for use in children older than 12, none less than 12. And it's going to be a few months before we get data. So it's not going to be, in less than 3 or 4 months before we might get a vaccine for kids.
We have one more question. As little children do shallow breathing, should they be using masks?
Yeah, I don't think it's the shallow breathing or anything. We need to protect them. So we don't need to get concerned about shallow breathing. But yes, we should get them a mask, but it has to be a mask that they like.
And there is one message from Jaya Singh. What are the blood tests to check for MISC?
This is a long list. So, one has to go through blood counts, and we might look at liver function tests and LDH and CRP and ESR and maybe some other tests as well.
And there is one question which has been asked. What are the typical symptoms of COVID in kids which we should be looking at precisely during this wave?
Well, there's nothing very distinctive. Like I said, there could be no symptoms to a little bit of fever, to a cough, to some fatigue, not wanting to eat, or just not being themselves. So you can't really make a diagnosis. It goes in with what is happening in the family. Is anyone positive or not positive? And that's when you start thinking about, is it COVID or not, and then decide on testing.
And is the antibody test for kids the same as adults, or is there a difference in the
No,
blood
I mean,
test?
if you're positive, or the cutoff remains the same, it's not different.
Okay, the entire procedure remains the same for testing for adults and the kids.
Yeah, a 3-ply mask is better than 2-ply. I'm just reading some of your questions. Blowing up a balloon makes your kids' lungs stronger, but it enhances their ability to breathe better, but it's not going to protect them against an infection if that's what we want. If that's the goal, then the answer is no.
Srivaths had a question.
Yeah. So, doctor, just question not related to the medication or anything. What has been the worst case in India with respect, or across the globe, with respect to the COVID impact on children or toddlers within the age group of 10, which you have come across, and what were the causes of the worst casualty?
Well, you can get MIS-C. So, an MIS-C, some children can get very sick with MIS-C. So that's really it. Some children in the acute phase of COVID can get, what we call as the adult respiratory distress syndrome, and get into trouble with their breathing and oxygen saturation falling and getting a cytokine storm. But both of these conditions are rare. So I would much rather focus my attention on the 99% likelihood of not getting anything serious, and not have to worry about that 1%.
All right, just an add-on question. So nothing to do with COVID per se, but the times that we are living in, children are just put up inside a house of 4 walls, and there's a lot of psychological impact that the kids are going through, as much as we go through, even the children. So do you have some thoughts to share on how we should approach, what are the things that we should do?
Absolutely. I mean, I think it's been tough on parents, it's tough on kids. After all, your online classes on one side, interaction with kids online, and so on and so forth, it gets too much. So try and get them out if you can to a park and to an open space. When you're inside, try and spend time doing things they like to do, not what you like to do. I think we are going back to reading books, which wasn't in fashion. We always, and all you guys are busy guys, so you always have this excuse, I spend quality time. It's quality, not the quantity, that matters. So now you have tons of quantity. So make the quantity count, is what I'm telling all the parents. You have quality and quantity, and make the most of it. Bond. Let that be the positive thing to come out of COVID, that you have such a solid bond with your children. You know more about them. They feel they can talk to you about anything. They feel, that they can interact with you and talk about stuff that's bothering them, and that you will not be judgmental and will actually try and understand how they think and how they function. So let's make the most of it. And that, I think, can be something positive that comes out of the pandemic.
Absolutely. Yeah, I think we have answered most of the queries. And even if someone has any questions, they can raise a hand. I'm sure like everyone is well satisfied. It was a very informative session. Thank you so much, doctor, for taking out time. And we have one message coming in. Thank you so much, doctor, for taking out time. I know your schedule was really busy, and just one message and you said yes to this. Thank you so much. Over to you, Srivaths.
Just a minute. I think Tejeshwari Goyal has raised her hand. Would you want to say something, ma'am?
Ma'am, kindly unmute yourself. I'll do that.
Yeah, am I audible?
Yes, ma'am, you are.
Yeah. Good evening. My daughter has just recovered from COVID, but I can see at times that she is having cough. I would not say she is coughing all the time, but I'm a little worried about why she is coughing. I would like to know if there is any tests or X-rays that I need to go through. I mean, a doctor has already discussed about not having a HRCT done. That is all right. But I'm still worried about why she's coughing.
Yeah, sometimes the cough takes a while to settle, so don't get unduly concerned. I don't think we need to rush into getting tests done and getting a chest X-ray done, unless of course there are other symptoms like fever, or the child is struggling to breathe, or there's breathlessness. So if it's just a nagging cough, that can take a while to settle. So don't worry about it. It will go. It's
So
only a
do
matter.
do I need to give her any kind of cough syrup or something?
Yeah, you should give a cough syrup, something to soothe the throat, but that's about it.
Okay, so if it is still persisting, then do I need to think about it?
Well, it largely depends on the larger picture. Like I said, cough on its own, not such a big deal. But if there's cough with something else, maybe we need to investigate, but not otherwise.
So like for 2 months, I can still wait and see.
Well, I don't know about 2 months. It largely depends on, when the positivity was, what were the symptoms, and so on and so forth.
All right. Okay. Thank you.
You.
Dr. Sibal, we have one more question. What about the vaccination for pregnant mothers?
Go ahead, there's no problem. I mean, the American College recommended it, the Royal College recommended it, FOXI, which is the Indian Society, recommended it. There have been thousands of women who've had the vaccine. They didn't know they were pregnant when they got the vaccine, and everything's worked out quite all right.
Yes, over to you, Srivat.
All right. Firstly, thank you so much, Doctor, for having a giving us an informative session. The number of messages that I keep seeing here and on the other groups, I think it speaks testimony about the kind of value that you've given us over the last 1 hour. And I'm very happy that you're bang on time. So thank you, Anshul, for introducing Dr. Sibal to us and hosting the session and then giving it transport. Very, very well done session. The only thing I just pray and hope that all of us stay strong and healthy and safe, and ensure that we come out of this pandemic much stronger and have a normalcy. So thank you all the participants as well, both YM members and the other members, for coming around and being part of this. There is a small announcement that which I mentioned in the beginning of the session. I'm beginning mentioning it now. We have an initiative from the Via Delhi for providing support to the parents of children, the parents who have lost their job but are trying to support the education of their children. We're trying to see how we can contribute a little bit of that sum. So there is a link in the chat box which will lead you to a page of the Lakshyam NGO, which we have partnered with, where you can contribute whatever little sum that you can towards this noble cause of educating and trying to support people who have had the bad times on account of the COVID. So thank you all once again. Wish you all a good evening. Thank you.
Thank you.